Hi there, my name is David Coletto and I'm the CEO of Abacus Data. Welcome to In Focus. At the end of 2020, my firm conducted a national survey of 2,000 Canadians, asking them questions about the state of Canada's healthcare system and the role that self-care can play in sustaining it and improving it in the future. On February 3rd, I led a panel discussion with leading experts and policy leaders exploring how self-care is being used around the world and how it can be used in Canada to improve not only patients' health outcomes, but also improve the sustainability of Canada's healthcare system overall. Here's what we heard. Coming back to the survey then, one of the things we wanted to explore was, in particular, an understanding that Canadians realize that the costs to healthcare are substantial. And before we introduced the concept of self-care to the respondents, we wanted to understand whether they would favor particular policy actions as well as just a general strategy that would help, in their minds, lower the cost of healthcare. And you can see the list here. All of them get broad support. Things like ensuring that Canadians are well informed about health and wellness matters and have access to the best information. That seems like a no-brainer, right? And it pretty much is, with almost every Canadian saying they favor that. Creating more incentives for Canadians to live healthier lives by eating better and exercising more. The federal government already does a lot of this in its healthy eating strategy, but are there incentives we can put in place? Supporting Canadians' ability to take care of themselves to reduce unnecessary trips to the hospital. That by itself, the foundation to what self-care is, finds, again, over 80% of Canadians favor that. Expanding the role of different health professionals in the system, like nurses, pharmacists, paramedics, expanded scope, which is being discussed in provinces across the country. And then lastly, ensuring that Canadians have access to all the same innovative non-prescription medicines and natural health products as those in the United States or Europe. In fact, I think Canadians would be surprised to learn how the difference in product categories and availabilities that exist in different countries. The last slide I'll share on this section relates to, I guess, the basic principle of it. And so we asked Canadians whether they agreed or disagreed with this statement. Canadians need more tools to care for themselves and a strong, resilient, publicly funded healthcare system there for when they can't. And you can see here, almost everybody agrees with that. There's very little disagreement. And I think what this statement and the research really confirms is that the basic principle of self-care is that we're not going to replace the public system. We're not going to, eliminate Canadians' access to health professionals or their family doctor, but we're going to make that system stronger by enabling them to decide for themselves when they need to go to that physician or not and care for themselves more effectively. So, Jerry, I'll start with you in terms of what this all means. How, in your mind, does a focus on self-care make a difference in people's lives? We'll talk about, your organization's call for a national strategy for self-care. But before we get to that and what government can do to get there, why is this so important, both from a macro level, system-wide, as well as for the individual Canadian?
Sure. Well, I think probably the easiest way to illustrate that is to look at a particular health condition. So let's look at something like frequent heartburn, which is sometimes referred to in medicalese as gastroesophageal reflux disease, or GERD. This is a very common condition, people getting frequent heartburn. And if the over-the-counter antacids and acid blockers aren't doing the job for them, their only alternative historically is to go to a doctor and get a prescription for a medicine class called a proton pump inhibitor. So a brand name there is Nexium. And remember that this is a recurrent condition. So that means that every time a patient suffers an episode, they have to book that appointment, wait for the doctor visit, and then go pick up the prescription, et cetera. And they don't get relief until that happens, even though they know exactly what needs to happen. That's where something called Rx-to-OTC switch comes in. So this is the business of taking a prescription medicine, and once you've determined that it can be safely and effectively used without a doctor's supervision, you make it available over the counter. And that has happened in this class of products, so that you can now get it over the counter. And that, for the patient, very straightforward proposition. They're getting the same treatment. They no longer have to wait. So they're getting quicker relief. So from the patient perspective, that's pretty straightforward stuff. From the system perspective, we actually worked with the Conference Board of Canada to take a look at, well, what are the impacts when you make a move like that? What the Conference Board found was that that single class of medicines can save the healthcare system about $700 million a year. That breaks down in a really interesting way. $186 million of those savings would be from the portion of people who currently get it by prescription, who no longer have to see a doctor. So there's $186 million in savings just in doctor visits. The second big chunk, it's actually a bigger chunk, is the savings to the drug plans. And that one's kind of interesting because that's roughly split 50-50 between government and employers. So very broad repercussions. That's $365 million in savings. And that's because the cost of a prescription version plus a dispensing fee is substantially more expensive. And of course, they're not covered by drug plans when they're switched. Maybe the most surprising thing in this one was that there's $250 million in savings in labor productivity. So to our broader economy, and this, by the way, is historically a really weak indicator in Canada. The Canadian economy has really struggled to increase labor productivity. Mm-hmm. That increase in labor productivity comes from two things. The time taken away from work to go see the doctor is one component, but the other component is that the quicker access to relief actually, and I was amazed that we actually had Canadian data on this, we had data to show that when suffering from GERD symptoms, there's a measurable decrease in economic output from individual workers. So you tally that up, that's over $750 million. But the give back is that you're transferring about $81 million to out-of-pocket costs for consumers. Even there, I think we have to take that with a grain of salt. First of all, it does point out to the fact that our system is not ideal. We're not providing, barrier-free access either way. But it's also worth mentioning, though, that for the people who are suddenly paying out of pocket, those are people who previously in this country were the privileged, folks who had a first dollar drug plan that covered all their costs. They're typically better off Canadians. They're also typically salaried Canadians, mm-hmm. And so they're not being penalized for taking time off work. By contrast, for those lower income Canadians and entrepreneurs or self-employed folks who don't have a drug plan, what they're seeing is A, they don't have to take that time off work to go see the doctor. But secondly, the cost of an OTC is $16 versus $48 for the prescription version. So it's not perfect, but the savings are enormous. And there's really room here to think about how do we better, coordinate among stakeholders so that those savings are spread out more evenly.
And Jerry, your point is well taken, because Nardine, often when we talk about self-care, there's those who say, whoa, if we go down this route, that means we're going to start dismantling or privatizing parts of our system, right? Patients and Canadians may lose access to some of these systems. How do you respond to that criticism or those arguments?
Yeah, great question. So I would say that, the outcomes of the self-care interventions have proven quite the opposite. So they actually benefit and support both the individuals and the healthcare systems, and they contribute to improved health outcomes. So first, and Jerry alluded to this, effective self-care is going to end up saving an individual time, money, and effort by allowing them to just manage their conditions conveniently and successfully on their own without having to go visit the physician. And it also empowers patients to make more informed decisions and take a more active role in their own well-being. And that will result in improved health and quality of life. Secondly, it complements our publicly funded system. It doesn't replace it, it complements it. It makes it more sustainable because it reduces cost and eases workload of the strained system while increasing healthcare access and equity. And so all of this leads to more efficient use and allocation of healthcare resources and services. And one of my favorite examples is that, if just 2% of Canadians who regularly would visit a doctor for mild to moderate cold symptoms, headaches, or heartburn, if they practice self-care instead, it would eliminate close to 3 million unnecessary doctor visits annually. And that would free up sufficient resources to allow, up to 500,000 Canadians to have access to a family doctor. So that's a really big number. So like the bottom line here is, these short-term investments that we can make in self-care will lead to demonstrable long-term savings for, governments, healthcare industries, and in addition to maintaining optimal health outcomes for patients. So it's a win-win. And
so Christine, there was a question from Dan in our audience asking about, I think what he's coming to is technology has enabled us to access more information. It's also e-commerce has perhaps opened up new channels for us to buy even illicit or uncontrolled products. How does health literacy and a focus on that stop that sort of the negative side of this shift in technology and access to what will be mixed information, right? Like in the same way that you can have two sides of a story, how do we know what's right and what's wrong, and where does health literacy fit into all of that?
I think we see, you are, of course, many of you are market experts, but in my mind, to make it very simple, we have the non-consumers, the consumers, and the prosumers. And prosumers, they know very well what they want to buy and why they want to buy it and where they can buy it to help themselves grow. We all know people running marathons who are eating all the best things they have to do and keep themselves fit and healthy. These are not the people we're worried about. Then we have the consumers who are the worried well, who may know where to go and who have an idea of what to eat and do to take good care of themselves. And they may ask for advice or they may just abstain. And then you have the non-consumers who are really left behind, either because they are ignorant or because they don't care or because we haven't been able to really provide them with the right services. So health literacy is one way to support, especially the worried well. I do see some challenges where many systems have been provided one size fits all services, and it means that for some people the prosumers really they get overloaded with information they don't really need. And we have that's lost resources in a way because it's not needed. And there are others where we expect too much and they're actually not really capable of doing it. So I think a way forward also for self-care and for people involved in self-care is really to do people-centered and targeted services and products that really help when people need it in a timely and relevant manner.
Well, that concludes the latest episode of In Focus with David Coletto. On behalf of my team at Abacus Data, I want to thank the panel and for all of you for tuning in today. For more episodes on this subject or others like it, please subscribe to our YouTube channel, and I hope to see you next time. Take care.